Hi, everyone. Thank you for joining today's presentation by the Health Connector and MassHealth, where we will share information about health and dental coverage options. I do see a lot of folks joining us. I'll just give them a few more seconds before we get started. Hello and welcome, everyone. The name of this presentation is Health Insurance Coverage Options for Massachusetts Residents Losing Access to Employer-Sponsored Insurance. We will get started at noontime as scheduled. I'm Nuri from the Massachusetts Health Connector, and I'm joined by my colleague Nikki and our MassHealth colleague Belkis, who will be presenting today's information. In attendance, we also have Melissa and Thalia from the Health Connector and Abby from MassHealth, who will be supporting with questions. Together, we are here today to share information about the health and dental coverage options available for Massachusetts residents, specifically those who are losing access to employer-sponsored insurance. We'd like to take a moment to thank our community partner organizations and elected officials across the state for their support in promoting this webinar, including our partners in the state legislature and our congressional delegation. Before we get started, we do have some information about our presentation format. First, everyone's audio has been muted and video has been turned off. The presentation portion will last approximately 30 minutes, then we'll have time for a question and answer period. If you would like to ask a question at any time, please use the Q&A button at the bottom of your screen. We'll be monitoring your questions throughout the session, and since we are expecting a large audience and many questions, our colleagues will be assisting on the back end. While we may not address every question individually, we'll be discussing key themes during the Q&A portion. And also, of course, feel free to scroll through the Q&A at any point as your question may have already been addressed. Please do not share any personal information or private health information when you ask your question, as others on the call are able to see what you write. If you have a personal scenario that you want to discuss with someone, we'll be providing contact information for the customer service centers and instructions on how to find help from a local assister. Lastly, we are recording today's webinar, and following the session, you'll receive an email with the presentation, so there's no need to take detailed notes. That being said, I'll hand it over to my colleague, Nikki, who will kick us off. Nikki, I think you're on mute.
Thank you for that. So thank you, Nuri. Thank you for the great introduction, and thank you everyone for taking time out of your day to join us for this presentation. As Nuri said, we are here from both the Health Connector and MassHealth, and we are here to just share information with all of you today about health and dental coverage options for residents who may be losing access to employer-sponsored insurance. So on to the next slide, I'm going to step through today's agenda. And both my colleague, Belkis, and I will be covering the following items. We will be doing a level set so that everyone understands what MassHealth is and what the Health Connector is, how we relate to one another, and also how we are different. We will be covering some common questions that people typically who are outside of this world may be looking for health coverage for the first time, may just want to know right up front. Then Belkis will be going over application requirements, and we'll both be talking about coverage options as well as when to apply. And lastly, because we'll be covering so much information, we'll spend time talking about the different ways that you can get free help with this process. So going on to the overview, I'd like to turn this over to my colleague so that she can start by explaining the MassHealth populations and really what that coverage is all about.
Thank you, Nikki. So I'm going to be reviewing the MassHealth populations that we serve. So firstly, MassHealth provides health benefits for qualifying children, families, seniors, and people with disabilities living in Massachusetts. We may also help with these benefits either directly or assist in paying all or part of your health insurance premiums. MassHealth members have access to doctor's visits, dental coverage, prescription drug plans, behavioral health services, and other important healthcare services. As you can see on the screen, there are two predominant populations that we serve, and the reason why we have it listed out this way is due to the applications and how we utilize them. For the focus of this presentation, we're going to be looking at individuals and families. And included within that are individuals under the age of 65 living in the community, meaning not in a nursing facility or in an assisted living. We also request that people who are individuals of any age that are caretaking or parents of children under the age of 19 utilize our ACA application. We're going to talk a little bit about what that looks like. As far as parent caretakers, it's really any individual who is in charge of, guardian of any children under the age of 19. Next slide, please. Now I'll pass it back to Nikki.
Thank you. Thank you. So let's talk about what the Health Connector is. So some of you may be less familiar with who we are, and we're the state's health insurance marketplace. So we're here to offer individuals, families, and small employers access to affordable health insurance coverage. So you might be wondering, okay, I understand that MassHealth is the state's Medicaid agency and, who they serve, but who is coming to the Health Connector? So it's really people who don't have or aren't offered health insurance through their job or another source. So they're not getting coverage through a spouse or a partner's position either. And when somebody has employer-sponsored insurance but loses it either to a layoff, a closure, etc., typically people have the opportunity to enroll in Cobra coverage. However, the Health Connector is another option for individuals who may be losing access to coverage. So we will explain that. A lot of people who apply for help paying for their premium become eligible for a $0 premium payment, or they are eligible for some other type of savings. We speak a lot about health insurance coverage, but certainly want to acknowledge that the Health Connector also sells dental coverage. And then lastly, the Health Connector has a separate product line for small businesses that have 50 or fewer full-time employees. We will not be covering that content today, but if anyone happened to get into this webinar today and wanted to learn more about Health Connector for Business, I would just encourage you to go to our video library, review past sessions, or even go to our events page, and you can sign up for an upcoming Health Connector for Business webinar. Now, on the next slide, I believe we have just more information about Health Connector as an alternative to Cobra. So this is really important for people to understand. And again, this might be the first time you're hearing some of these words. So when someone loses access to employer coverage, whether again, it's your coverage, your employer, or a spouse's coverage or partner's coverage, that when that happens, that gives you a special enrollment period. So that allows you to apply and enroll into coverage through the Health Connector. And a lot of times people ask us, and we're happy to review this again, but if you've lost your health insurance or you're going to lose it, you can apply in advance. So you can apply within 60 days of losing that coverage. And then, you have to think about when, of course, this is happening. The Health Connector has an open enrollment period and a closed enrollment period. So if this is a situation that you're in, the sooner you apply, the sooner your insurance can start. Because once this special enrollment period is over, if you don't have any other type of qualifying life event, you might not be able to get into Health Connector coverage until the next open enrollment. Now, moving on to the next slide, I want to talk just a little bit about our relationship. So you've heard Belkis describe that MassHealth is our state's Medicaid program, as well as the Children's Health Insurance Program. So together, that is what makes up MassHealth. So they're here to provide free or low-cost health insurance coverage to eligible individuals. It's administered by the state and funded by state and federal government. And it's really based on income, age, disability, as well as other factors. And people have an opportunity through MassHealth, if you're MassHealth eligible, it's continuous enrollment throughout the year. That program is not something that you need to have a qualifying event for. Now, separate from MassHealth is the state's Health Connector. Now, the Health Connector is our state's marketplace for insurance plans. Now, we're here for both individuals and families. We offer access to commercial health insurance plans as well as programs where individuals are eligible based on income and other factors. So the savings or the subsidies that people can get, it will vary, but important and different from MassHealth, we do have open enrollment periods and closed enrollment periods. And if somebody is trying to access coverage outside of open enrollment, they do need a qualifying life event. So on this page, you're seeing an image of a laptop, and we really just want to stress, and we will say this again to all of you, there is one application for coverage in Massachusetts for MassHealth and the Health Connector, and that's the application you'll find at mahealthconnector.org. This is the one online application. That application is available in English, and because of our growing populations, it is also available in Spanish and Portuguese. A lot of times people get a little confused because they say, well, I didn't want to apply for MassHealth. Why am I getting a letter? Or conversely, I just want to apply for MassHealth. Why am I getting a letter from the Health Connector? So technically, legally, even though we share a system, we still are separate organizations. So when an individual applies, what happens is all of the information that they are providing in this application is going to be reviewed, and we check to see if somebody is eligible for Medicaid first. And then if they're not, then the system goes through and they move on to Health Connector to see if they're eligible for the Health Connector. And when somebody applies, they do get a letter from both of our organizations acknowledging whether or not they're eligible or they're ineligible for Medicaid, MassHealth, or the Health Connector. So moving on, I want to move into some common questions. And Balkis, if we can, Health Connector. Let me start with Health Connector. So this is a question that we typically get about Cobra. So again, I mentioned this already, but I just want to acknowledge that instead of taking Cobra, because Cobra is the continuation of coverage that you're currently enrolled in from your employer, when you choose to enroll in Cobra, typically you are agreeing to pay the full cost of your monthly premium. So you don't have an employer contribution. So a lot of times individuals are kind of a little surprised by the cost of what this plan is. So really important to acknowledge that if you are going to enroll in Cobra and you are fully responsible for paying that premium, you may want to consider applying through mahealthconnector.org and figuring out if you are eligible for coverage with the Health Connector or even MassHealth. Now, I mentioned that the Health Connector had a program where people could save dollars, and that's our Connector Care plan. So it's a set of plans that have lower monthly premiums, lower out-of-pocket costs. And the reason they are affordable in that way is because they're partially paid for by the state. And you also have access to federal tax credits, which we'll explain a little bit further. So if you qualify for a Connector Care plan, you will be able to take advantage of many savings. Now, if you are looking to buy health coverage outside of the Health Connector, I think it's really important to note that you won't be able to get access to help paying for that. So there won't be federal federal tax credits. There won't be state dollars as a contribution. But however, individuals can in fact still go to a carrier if that is what they choose. And if someone gets health insurance from their job, I know a lot of times people wonder, like when I apply for Health Connector coverage or choose a plan and enroll, does that mean I'm in a contract? Like, can I drop this once I have access to other coverage? And the answer is yes. You can cancel this coverage at any time. There are, of course, certain dates that you need to do that by, but please know that you are essentially buying something that you need. And if you do need to let it go because you're ready to move on to another full-time position and take on that coverage, you can in fact do that. So now I will hand it over. Thank you.
So some of the questions that we get at MassHealth are, do you need to live in Massachusetts to apply for MassHealth? Yes. You need to be a resident of the state of Massachusetts in order to apply for coverage. But what does that mean? It means that you either have a residential address or you have the intention to reside in Massachusetts, because there are individuals who have accepted, let's say, a job offer in our state and are in the process of finding permanent residence, but they plan on staying here. So that is a stipulation in which you can apply for coverage. For individuals who do not have a fixed residential address, whether they are considered homeless, we do advise you to apply for MassHealth. And if you don't have a residential address, that is okay. You can just check it off on our application, both on paper and online. What we do require is that you provide us a valid mailing address, and that can be a P.O. box or a shelter address or the address of someone that you trust to receive your mailings at. You are not considered a resident of Massachusetts if you are here on vacation for pleasure or seeking medical treatment that is outside of a nursing facility. If you're just here to get a surgery and you plan on going back to the state in which you reside, you wouldn't be considered a resident of Massachusetts. Something else that we get asked regularly is, do you need to renew your MassHealth coverage? Yes, your coverage is renewed on an annual basis, and you will receive notification of this in either one of two ways. In many cases, we do try to automatically renew our members, meaning we check the information that you've provided to us, and if everything is verified, then you will be automatically renewed and you would get a letter indicating that. Congratulations, you've reapplied and you are eligible for the benefits that you are currently receiving. The alternative is, if we're unable to verify the information that we have on file, you will get a blue envelope specifically with a renewal application, which you are required to complete and submit within the date that it is provided on your notice. So it's really important that you're checking all of your notices from both of our entities, because it can inform you of whether you need to do a renewal, of any changes that might be coming, or additional information that we require from you as an applicant. So what happens if you get a new job or change jobs? It's important to let us know as soon as you get the notification. We require that you report it within a 10-day time frame. And the different ways in which you can report that information is by either logging on to your online application and making the updates to your employer information, whether that be a new job or not, or having lost a job. You can do it online. You also have the option of completing a job update form, which we will be sending at the end of this presentation, the links to that information, and completing it and sending it back to us. That way we can make the updates. You can also just call our customer service line in order to update your income information as well. What do I do if my income changes throughout the year? So we always recommend that you make any changes upon them occurring, because many things can happen, especially when it comes to jobs. You may go into a new job, you may lose a job. Your income may change due to hours. So any changes that transpire throughout the course of the year, just make sure that you're making the necessary updates so that we can have the most up-to-date information and provide you the benefit that you're entitled to. And here are some resources available as well on how to report those changes as they come. And again, you can always call our customer service line to make any updates to your application. Next slide, please. So how do you report your income? So on our slide, we have a picture of our income screen if you're doing your application online. If you're doing it on paper, they ask you very generic questions. So some of the things that you need to keep in mind is that you would have to indicate your income source, and there are many. You can have a job, Social Security benefits, unemployment, or self-employed, so on and so forth. So you would indicate the income source that you are receiving. There's also an option to continue through the application if you have no income. Make sure you check off all the necessary boxes for your income for yourself and each member on your application so that you can move through the application and make the necessary updates. Next slide, please. So for some of you that may receive one-time only income payments, that can be things like winning the lottery, a severance package, a one-time bonus. You can indicate one-time only income by selecting other income. On the previous slide, there's an other income box. You would select that, and then you will be prompted to provide that information. If what the source that you receive is not available on the checkboxes, you can always select the other box, indicate the income source. So if it's lottery winnings, you can select lottery. Well, you can type in lottery. And then in the next box below, you can select that it is a one-time only payment and indicate the amount that you received. And once you enter that, you have to do the gross income amount. So if you're doing the lottery, for example, you can have taxes taken out. We look at the gross of those payments that you receive. Make sure that you're reporting it for the month and the year in which you received it. So you are required as an applicant of either program to report the changes within 10 days. So indicate the month in which you received that payment. That way we can have an accurate portrayal of the income that you are receiving. Next slide. Yearly income. So our system typically calculates your yearly income automatically based on the information that you provide. But we also recognize that that might not always be correct because there are income sources that are not, you cannot receive throughout the course of the year. They may be temporary, and it may not be an actual reflection of the income that you received throughout the year as a whole. So kind of think about when you're reporting your taxes, that income that you get at the end of the year after all of the income sources that you may have received throughout the course of the year, and that's a more accurate portrayal of what you're getting. So if you're finding that what the system has calculated is incorrect, you do have the option of reporting and indicating what your actual income for the year was. So you would select no, that you do not agree with the amount that the system calculated, and then you will be prompted to provide the system your actual income throughout the course of the year. Next slide. So now we're going to review application requirements. So as Nikki indicated several times throughout the course of this presentation, it is one application, two programs. So when you are completing an application, you are essentially applying for a program and you will get the benefit that you're entitled to. So we will determine if you're eligible for either MassHealth or the Health Connector via this one application process. So you would go to the mahealthconnector.org website, and then the system will determine based on the information provided whether you are a MassHealth member or a Health Connector member, and then actionable steps following your determination. Next slide. So who should apply? If you are a member, if you reside in the state of Massachusetts, are a U.S. citizen, U.S. national, or otherwise lawfully present. Also keep in mind you don't have to have an immigration status to apply for MassHealth. To apply in general. It'll just determine which program you're eligible for. You can apply if you are enrolled in Medicare or other public health coverage. You may qualify for both Medicare and MassHealth. It'll just determine on how we may potentially supplement your coverage. If you are offered affordable comprehensive health insurance through your employer, please make sure to report that information. Again, you may qualify for additional benefits or supplementary services and programs through MassHealth. And if you do not have health insurance, you're also able to apply. Next. Who should not apply? So those that are just visiting Massachusetts, either for vacation or to seek medical treatment, shouldn't apply for coverage because you're not a resident in those instances. There are certain considerations. If you are eligible for comprehensive health insurance, including Medicaid, Medicare, and you will not be eligible for Health Connector. So if you are eligible for MassHealth or Medicare, you wouldn't be a Health Connector member. If you are incarcerated or in jail or prison, you can apply for MassHealth before your release date. But during the time that you are incarcerated, you wouldn't be eligible for MassHealth or the Health Connector. Next slide. So what do you need to apply? And keep in mind, it's not going to be perfect, but we do want you to be prepared as you're completing these applications. If you have Social Security numbers, we ask that you provide them. Understand you are not required to have one because there may be circumstances in which you do not have one at the time of application, and that is totally okay. Please make sure you're providing up-to-date income information. So if you have copies of pay stubs, tax forms, benefit letters, please provide that if you're completing paper documentation. Proof of address, so you can have a lease, a mortgage, or utility bill. Keep in mind that, again, if you do not have a permanent address, just make sure that you're indicating that on your application so that we can make sure that we are looking at your situation appropriately. Also, please have your immigration documents available because we may ask for them for all of those that are applying. And again, if you do not have an immigration status, that is okay. You can still apply for benefits. And any other health insurance information, such as Medicare or employer-sponsored insurance, we do ask for that information if you have it. If you do not have other insurance, that's okay as well. That's why we're here. Make sure that you apply. You may get MassHealth even if you already have insurance, because we do have additional programs that may help you with the costs or some cost sharing initiatives to help support you with the alternative insurance. MassHealth and the Health Connector may be able to verify a lot of this information that I just reviewed through electronic data sources. But in the instance that we're unable to verify the information provided, you will receive a notice in the mail asking for additional proof. So please keep your eye out for any mailings that you may receive. Next. So what is the best way to fill out an application? First, please make sure that you're answering all of the questions for all of the applicants on the application. We do look at everyone on a case-by-case basis. Not everyone's situation is the same, so make sure that you're answering all of the questions so that we are able to provide you an appropriate determination. Otherwise, it may hold up your application process. When reporting your income, make sure to enter gross wages. That means everything pre-tax. So we do not make sure that you are providing your gross information. We do ask on the application about any eligible deductions, and there are screens for that as well as on our paper application. So make sure that you're providing all of that information so that we can look at your income appropriately. We also ask for weekly hours worked as well as the pay frequency because, again, we need to make sure all of that information is provided in order to process your application. Otherwise, it may hold up the process. When reporting your yearly income, if you are especially completing a paper application, please do not write NA or not applicable. We need an actual amount. So make sure that even if you are not receiving income, that you write the number 0, or you can even write 0 income, just so that we know how much you received throughout the course of the year. When completing an application, make sure that you are providing a signature, you print your name and that you date it so that we're able to process it. Otherwise, we can't. E-signature is applicable. It is required if you're applying online. It is also acceptable on paper applications if you are using an Adobe Sign form of an application. Applications can also be done on the phone. We do have a recorded line, so that is the way that we capture your signature. So those are different methods in which you can complete an application. If you need any help applying, there are enrollment assisters throughout the community, and we will provide those resources on how you can find additional help if you're unable or have any questions in completing the application. There are also MassHealth enrollment centers located across the Commonwealth of Massachusetts that you can go to in person and speak to a MassHealth eligibility worker to get assistance in completing your application. Most importantly, after you complete your application, we may ask for more information. So please make sure that you are looking out for any mailings that we may send out, because again, you may get requests for additional information that we may need at the time of application. We may be providing important updates or any changes, whether it be for insurance purposes, or we may need more information from you. So just make sure that you are looking at your mailing, just so that you know what next steps you need to take as an applicant and member to maintain your coverage. And make sure that you are submitting the documentation within the due date that's provided on the notice. Otherwise, you may run the risk of having a change in your benefit. Next slide. So what happens after you are approved for MassHealth or MA Health Connector? Once we've received all of your information, we will make a decision and let you know what you're eligible for. If you are approved, we will let you know if you qualify for MassHealth benefit or a Health Connector benefit. So what does that look like for MassHealth? So you will receive a blue MassHealth ID card that you can present at any upcoming doctor's appointments. You will be prompted to select a health plan through MassHealth, and you can go on our MassHealth Choices website to see what plans are in your area or that your doctor may accept. If you enroll in a plan, you will receive a card from that plan, and is often a white card that you can present at doctor's appointments, as well as your blue MassHealth ID card. Please make sure that you're reporting any changes throughout the course of your year for any job, income, changes in household, or changes in immigration status. You have to report it within a 10-day period just to make sure that your information is up to date and we're providing you the most comprehensive benefit that you're eligible for. And your health care benefits will be renewed on an annual basis. So now, if you're found eligible for a Health Connector plan, here are some things that you need to be aware of. You will be able to compare plan options online through the online portal within your application. So once you get that approval for a Health Connector plan, you will be able to shop for a plan online. You will see the carriers in your area and the monthly premiums associated with those plans. You can also search and find out if your preferred provider, facility, or specific medication is covered through that plan. And then once you compare your options and decide, you will need to select a plan, when you want it to start, and place it in your cart to check out. If you owe a premium, you must make the payment by the 23rd of the month for the coverage to start the first of the following month. So if we're talking about this month, if you apply today and you're eligible for a Health Connector plan, and you have a premium affiliated with the cost of that plan, you have to pay it by the 23rd in order for your benefit to start as of April 1st. And that's just an example of how that works. Next slide, please. Coverage options. So for those that are found eligible for MassHealth, here are some of the coverage types that you may be eligible for. MassHealth Standard, we offer a full range of healthcare benefits, so that goes for medical, dental, and vision. For Common Health, it offers a full range of healthcare benefits, specifically for individuals with disabilities, both adults and children, who are not otherwise eligible for MassHealth Standard. Care Plus also offers a broad range of healthcare benefits to adults who are not otherwise eligible for MassHealth Standard. And this is typically for adults that do not have any children. For family assistance, we offer a broad range of healthcare benefits to certain children and adults, including non-citizens who are not eligible for MassHealth Standard. So if you are eligible for any of the coverage types that are with a black box, you will need to enroll in a health plan, and that's assuming that you do not have other health insurance through an employer, because otherwise you will not need a health plan for those circumstances. But if we are your only insurance carrier, then you will have to select a plan through our MassHealth Choices, or you can do it over the phone with our customer service. For MassHealth Limited, we provide emergency services to people who, under federal law, have an immigration status that keeps them from getting a more comprehensive benefit. Children's Medical Security Plan, also known as CMSP, provides coverage for primary and preventative medical and dental services to certain uninsured children who do not qualify for any other MassHealth coverage. And then Health Safety Net, which is typically considered our free care, may be able to pay for certain services that you receive from acute care hospitals, a community health center. If you are a resident of Massachusetts or you are uninsured or underinsured, Health Safety Net can be an assistance for some health benefits. Keep in mind that Limited, Children's Medical Security Plan, and Health Safety Net are not considered insurance for tax purposes. So you would not get a 1095 for proof of insurance if you have one of those three coverages. Next slide. And now I'll pass it back to Nikki so that she can review the Health Connector plans.
Great, thanks so much. So let's talk a little bit about the Health Connector plan. So initially, I want to just acknowledge that all of the plans sold through the state's Health Connector meet both state and federal coverage state and federal coverage standards. So what does that mean to you in Massachusetts? Essentially, you know that you're going to get comprehensive coverage and you would never be penalized by enrolling into a plan that you purchased through the state's Health Connector. So all of our coverage options are known as qualified health and qualified dental plans, and you can pick from a variety of carriers who are available in your area. And as I started to talk about earlier, some people may qualify for health plans with advanced premium tax credits. So this is a way that people can save on their monthly premiums by essentially taking tax credits. And those tax credits will go directly to the carrier, and you as the consumer just simply pay the lower cost. Now, for people who are in lower income ranges, who meet all our other eligibility requirements, they could qualify for a low or no cost connector care plan. So on to the next slide, I'm going to talk a little bit more about what that could look like. So Connector Care overall is a great program, and it really has lower premiums and copays and no deductibles. So if you're an individual and your income is less than $75,300 for 2025, you may qualify for a Connector Care plan and see some savings. Now, for a family of four, the income limit is $156,000. And if you go on to the next slide, I believe that what we have listed there, sorry, we don't have it listed there, but maybe I can just acknowledge, thank you for going back. I just want to acknowledge that, the way Connector Care works is it's almost like a sliding scale. So dependent upon your income, you're going to qualify for a particular plan type. So there's going to be a range of premiums that are available. And again, it depends on your household as well as your overall household income. Now, let's go on to the next slide. Thank you. Okay, so I just want to talk a little bit about enrollment deadlines. So I think we said this at the beginning, but I'm happy to just want to make sure this is coming across to you. So whenever you need health insurance coverage, you should be simply applying. And that's for a couple of different reasons. MassHealth does not have a closed enrollment period. So if somebody applies and they are determined eligible for MassHealth, their coverage can start, right away, essentially. So there's no closed enrollment. Now, for the Health Connector, we do have enrollment deadlines. And if someone is looking for coverage outside of open enrollment, they're going to need a qualifying life event that opens a special enrollment period. Now, during a special enrollment period or in open enrollment, this is when you can enroll in coverage, you can change your health insurance plans in the Health Connector. And this is a time when, if things like this happen. So, for example, if your household changes, like the size of your household, your income goes up or down, your immigration status changes, you move from one part of Massachusetts to the other part, maybe you're losing a job-based coverage, or maybe you're having a baby. There's tons of different reasons, but there are deadlines. So you do need to take action when these things happen. So if you're a Health Connector member or you're interested in being a Health Connector member, you should report any of these qualifying events within 30 days of it happening. And then you have 60 days from the date of the event to select a new plan. And then for the Health Connector, there are payment and enrollment deadlines that still apply. On our side, the payment and enrollment deadlines is always the 23rd of each month. On to the next slide. I want to talk a little bit about how to get help. And actually, if you go on to the next slide, I may hand this to Belkis to speak about this. Thank you so much.
No worries. So where can you get help? First, for MassHealth, you can actually contact our customer service line at 1-800-841-2900. That is one of the ways in which you can get in contact with us for any of your MassHealth needs. You can also visit one of our MassHealth enrollment centers, and we'll talk a little bit about it on the next slide of where they are located. But we do have 7 located across the Commonwealth. And then if neither one of these options are really viable for you because maybe the call lines are a little long or you're unable to get to an office in person, you can always schedule an online appointment and get a MassHealth representative through our appointment scheduler, and it'll schedule time for you to either receive a call or have a video appointment with one of our specialists, and they can assist you with any of your application needs. For the Health Connector customer service, you can call 877-MA-ENROLL or 877-623-6765, or the 711 for the TTY line for people who are deaf, hard of hearing, or speech disabled. For any information on their hours or days of operation, you can go to the Health Connector Customer Service Call Center website. And then they also have available any upcoming events in which you can seek assistance. Next slide, please. Oh, I'm sorry. Go ahead, Nikki.
No, I just wanted to say thank you for covering that. And I guess I also just wanted to acknowledge that, let's say you wanted to attend another webinar or you wanted to see if there was any event in your community, you can go to mahealthconnector.org/events and see if anything is listed there. And I'm also going to take this opportunity to just remind everybody, we realize there's a lot of information in this deck. We promise this will be coming to you in an email. So you really, all of this content, all of these links, you will have in hand. Now I'm ready.
Next slide, please. So these are the locations for our MassHealth enrollment centers. There are 7 across the Commonwealth. There's one in Charlestown, Taunton, Chelsea, Tewksbury, Worcester, Springfield, and Quincy. So as I mentioned in the last slide with the appointment scheduler, there's actually you have the ability to schedule an in-person walk-in appointment with our Springfield office. So that's included in the appointment scheduler. So that is an option. All of our enrollment centers, you are able to just walk in. You don't have to have an appointment, with the caveat that Springfield has the ability to have an appointment scheduled if that is what you so choose to do. Um, Members who are applying should not mail an application directly to any of these enrollment centers. The reason being is that we have a mailing where it allows anybody to process your application, and you can mail it to the Health Insurance Processing Center at P.O. Box 4405, located in Taunton. But you also can just go to one of these enrollment centers and drop off your application. Many of them do have a drop box located outside of each of these locations, so you can drop it off within that drop box and then go about your day, or give it to someone in person as well. Next slide. So for community partners, we have free enrollment assistance that is provided through some community partners across the Commonwealth. We have enrollment assisters that are trained and certified navigators and certified application counselors who speak a variety of languages, and they can help you apply and enroll in health insurance plans. They can also answer questions about eligibility, the application, payments, plan details, and healthcare reform rules and requirements. So if you are interested in scheduling an appointment with any of the enrollment assisters, whether it's a navigator or certified application counselor, you can select a link that says Get Free Help Near You and schedule an appointment at the closest assister near you. And now we're opening it up for questions. Thank you.
Alrighty. Thank you, Nikki. Thank you, Belkis. And I do want to acknowledge the colleagues on the back end who have answered over 100 questions. We recognize that there are still several questions in the Q&A, so we'll do our best to address them more broadly in the next 13 minutes that we have left. I'm not sure who wants to tackle this question, or maybe it could be addressed from both sides, but a lot of folks were asking about vision and what their options are there. Vision coverage.
So I can cover it briefly. And Belkis, I'm not sure what that means on the MassHealth side, but for the Health Connector, we don't offer separate vision plans. Some of our carriers and some of the plans that you enroll in do cover office visits to the eye doctor as medical. So that's something you'd have to look at the plan summary of benefits and coverage in more detail to see if the particular plan that you want to buy does offer any type of vision benefit. So on the MassHealth side, if you could speak to.
Yeah, absolutely. So for MassHealth, we do cover vision, depending on the coverage type that you're eligible for. Most likely one of our more comprehensive benefits. We do cover vision benefits. If you do select a health plan, you would have to look at what additional benefits that might come with vision, because each of our carriers may have differences in terms of if they have additional perks. So you may want to look at that, but we do offer vision coverage as well as part of a MassHealth benefit.
Thank you both. There were several folks interested in knowing the response timeline from each organization. So once they complete an application, and when can they expect to either get it approved or denied? I believe that was touched on, but if you guys could just refresh folks.
Sure. So for typically the lifespan of an application, we have about 45 days to make a determination once you submit your application. If you complete your application online, you most likely will get a benefit immediately, and that's assuming that we do not require additional documentation from you as an applicant. So if everything is verified, if you do it online, it'll be really relatively immediate. If you're submitting a paper application, we do have 45 days to process it, and then you'll receive some sort of a notification as to additional steps following. But if you need something sooner, you can always call and request it to be expedited as well.
And I guess I just wanted to add, from my perspective, and I apologize, I was answering a question, so I will stop. Um, so when somebody completes the online application for both the Health Connector and MassHealth, they're going to see, if you get to the end of the process, you're going to see your eligibility result. If you're under 65 and that's the application you're completing. What I want to point out on the Health Connector side is that all of the Health Connectors enrollment begins on the first of the following month. So depending on the day of the month that you are completing your application, you're going to be eligible. Like you may, if you did this right now, you could get coverage for April 1st. Let's just say that. Or April 1st or May 1st. You get to pick the next month. But really encourage people to try not to go beyond the 23rd of the month, as you might get bumped, and we're trying to help you avoid any gaps in coverage. So I hope that helps explain some of the deadlines to people.
Yeah, I think that does. And speaking of deadlines, I know this was covered, but Cobra, a lot of folks are still slightly confused about timelines when it comes to that type of coverage, what their options are, whether or not they can apply prior to the coverage ending. So if you could just, again, remind everyone of the general timeline for Cobra, that'd be great.
Sure. So Cobra is not a health plan, but rather a law that allows you to continue continue coverage in your existing employer's health insurance plan at a full cost to you. And I believe there's a small percentage premium, a small percentage additionally that you would pay. A lot of individuals do choose to go that route because it's the coverage that they know they're comfortable with for themselves and their family. But for the Health Connector, or as for you as a Massachusetts resident, we just want to acknowledge and be sure that individuals understand that before they enroll into Cobra, they should check out their options at the state's Health Connector, because they are likely able to shop and buy something that could be more affordable to them. Now, there are a couple of nuances there. Once somebody enrolls into Cobra and they start paying full price for Cobra, they can't just drop that Cobra coverage, then choose to come over to the Health Connector, unless it's at a particular time of the year, right? And we're in an open enrollment period, and you're ready to drop Cobra and begin with Health Connector coverage beginning January 1st. Now, there are always caveats to these rules, right? And so one really important caveat or nuance to this rule is that if sometime, we've been seeing this so much more since COVID, sometimes an employer will say, if you take Cobra, we'll offer you X number of dollars for the next 6 months period of time to help pay for that. If an employer is subsidizing your Cobra, or your union is subsidizing the Cobra, whomever is subsidizing the Cobra, when that subsidy ends, that will give you a qualifying life event again to get into Health Connector coverage. So I hope that's helpful. We essentially are just trying to help people save some money if they would prefer not to just pay that full cost.
The only thing I want to add is that while you're in the process of determining whether you want to continue and enroll in Cobra, we do have a pre-screen process. So if you want to check out potential options prior to making that decision, I would recommend that you do that, because if you can, you may be eligible for a MassHealth or a Health Connector plan that may be more cost effective for you and your families. So just take that into consideration as you're making this decision.
I guess that's a good segue into the next a big category of questions that I'm seeing here regarding household composition. This might be a little bit hard to tackle just because the questions that we have gotten are very specific to each household, but not sure if you guys could touch on just plans, kids, dependents, if, an individual has access to their employer-sponsored coverage and what the rest of the family should be doing. Again, I know this might be a little bit harder to tackle just because each scenario is very unique, but if there's anything that you could share broadly with individuals who have questions about this, that'd be great.
So can I start with something that's plain and simple? Because I think then I'll gladly let you get into the nuances. So plain and simply for Health Connector coverage, we look at your tax filing household. So when you think about who you include on your taxes, those are the people we want to know about in terms of your income. So if it's two of you and neither of you are working, or one is working and one is only working part-time, that's the income information and the people information that we want. If it is two of you and a child who's over 18 that you aren't claiming on your taxes, we'll stick with the two of you. Okay, we just want to know about the two of you. We want to know about those who are looking and in need of health insurance coverage, who's part of your tax filing household. Now, Belkis, I will hand it over to you.
Sure, make me do the hard stuff. Um, so because it is a joint application, we do look at tax filing status. That is the easiest way to make a determination. But we also look at household member relationships because not everyone can be claimed on someone's tax return due to a variety of reasons. So we do look at the relationships, the incomes, the immigration statuses, and so forth. I did peruse the chat a little bit. So I will say that if you are a caretaker specifically, and by caretaker, I mean a guardian, a foster parent, a ward, any of those categories in which you are responsible for a child age 19 and below, they can be listed on your application, even if you do not claim them on taxes. We do take these things into consideration as we're doing a determination. So my recommendation to folks is jot down your family as it currently exists, especially if you are a caretaker of someone under the age of 19. They are part of your family. You are responsible for them. When it comes to age 19 and older for mass health purposes, then we look at you differently. And that is contingent upon tax filing status. If you claim them as part of your taxes, we say put them on your application, especially if they're 19 and older. But the minute that you determine that you are unable to, you don't claim them on taxes any further, then they can complete their own application, even if they live in your house and you all share bills and things of that nature. But for health insurance purposes, 19 and under, or if you do 19 plus, we look at your taxes, and then we will determine on a case-by-case basis if we may need you to do a different application for an individual in your household based on a variety of circumstances. And we will communicate that to you on an individual basis.
And I know that we have a minute left, and you guys kind of touched on this in this previous question, but there were several questions about income and what should be reported. Particularly folks are asking about severance payments or packages. Not sure if we can send material as well after the presentation that specifically addresses what type of income should be included, but if there's anything that you'd like to share at this moment, I open the floor.
Yes, we can absolutely send you the direct link and the follow-up email where we spell out specifically what types of income needs to be included, so you can see a complete list. I know there were some questions about pension and retirement accounts, so I want you to look at the list so you can see it, like you have a thorough understanding, because everyone's situation is different. But yes, if you receive a lump sum, you do a lump sum as part of your severance that is considered income, So Belkis, I'm not sure if you want to just talk a little bit about how they should enter that again, because I think you
Mhm.
covered. Thank you.
Yeah, so on the income screen and on our presentation, there were some screenshots kind of referencing what this looks like. It has all of the income sources that we look at noted on the screen. Severance, I believe it would fall more so under other income. So you would select that option. And then you have the option of writing in, typing in what type of income source that is. So in that instance, it would be severance. Yes, so on this screen, you would choose other income, you hit the plus sign, and then if you go into the next screen, you would indicate other and type in that it's a severance. You would indicate your frequency. So in this instance, it would be the one time only, and you would then know the amount that you received. So if you received a severance package for $5,000 one time only, you would indicate that the income is a severance, select one time only as the option, and then the amount. I'm not as familiar with severance packages in terms of pay frequency, so obviously you would indicate whatever pay frequency they are telling you they're providing you. If it's more than one type, you would note that to the best of your abilities. If it's just the one time only, that's would make it easier. And then the other thing I want to mention is that when it comes to that yearly, if it's one time only, it will calculate it within your yearly income for the most part. But again, if you don't agree with the amount that the system is indicating for you in terms of your yearly income, you have the option of doing that edit of saying, no, I do not agree, and indicating the amount in which you are going to receive for the year.
Randy, I know we are at time, but are there any closing remarks that either of you would like to share before we wrap up our webinar?
Yes, I think first of all, we're so appreciative that everyone took time out of your day. We tried to get to as many questions as possible. If we did not get to your specific question, please know that you can reach out to either customer service center, ask your questions. They can help you start an application. If you want assistance doing that, either of them can help you do that as well. So please, we know everyone's situation is unique. Please do take the next steps. And we're so glad that we're able to be here as a resource. So, Belkis, from your perspective.
Firstly, thank you everyone for joining us today. And then I would echo what Nikki stated. When in doubt, you can always contact either one of our customer service lines to get assistance. There are enrollment assisters in the community that can also help you navigate this process. And it doesn't hurt to apply. I wouldn't discourage anyone from applying. If you want to see if you're eligible, do it. The worst thing we can say is no. And that's with life. So please just make sure that if you want to see if you're eligible, that you seek out the resources that we provided today during the presentation, and someone can help you navigate this process because we understand that it is challenging. It's not easy. And even if you have insurance, apply anyway. You might be able to get some cost savings from either of our programs. So please, I encourage all of you to apply.
Thank you both. And then one final reminder that presentation materials will be sent out for those who are still wondering. So there will be more helpful information coming your way soon. Well, thank you all for joining today's webinar from everyone at the Health Connector and MassHealth and all of our sisters across the state. We thank you again and we wish you well. Goodbye, everyone.
Goodbye, everyone.